How does gallbladder disease affect my life expectancy? These kind of questions have a lot of credible information available online. Some of my patients also do walk into the OPD and ask me certain questions that they may not have answers to. I am Dr.G.Uday Kiran, consultant laparoscopic surgeon at Srinandaka Hospital, and today I'm here to answer some of these commonly asked questions which my patients usually ask me when they talk about gallbladder disease. So gallbladder removal surgery is definitely recommended when gallbladder stones are symptomatic or there is acute cholecystitis, that is when there is intense gallbladder inflammation and infection. Asymptomatic gallbladder stones may not need surgery unless they are seen in a diabetic or someone with other comorbidities, because in such patients the pain perception is reduced, due to which they really don't experience any symptoms. So asymptomatic gallstones can be conservatively managed to a certain extent, but symptomatic gallbladder has to be addressed with surgery. Cholecystectomy or gallbladder removal surgery, as it is commonly called, is a fairly common surgery done all over the world. It's a very simple surgery in experienced hands. It takes about half an hour to 45 minutes to do the surgery, and it is usually done laparoscopically, which is minor minimal access surgery, where we give incisions that are about the size of half a centimeter, and through this we remove the gallbladder. So the post-operative stay immediately post-surgery is just about a day. Sometimes we even discharge patients on the same day if the surgery is done early in the morning. You can go back to all your routine activities immediately after the surgery because there's hardly any pain and the recovery is much faster because of the smaller incisions. Another commonly asked question is, does the gallbladder have to be removed all the time? So gallbladder removal is recommended because any disease in the gallbladder is a precursor to cancer of the gallbladder. Also, stones in the gallbladder, when they are formed, if we just remove the stones can come back. Also, if we remove the gallbladder, once the gallbladder is removed, there is no guarantee that stones will not form in the rest of the biliary tract. It all goes back to the saying that if your diet has cholesterol in it or you're having excess cholesterol in your diet, you will definitely have stones. There's another common question that patients usually ask us: what is my life going to be like after my gallbladder is removed? So life after gallbladder removal is fairly normal. Usually patients experience a little bit of bloating, a little bit of gastritis, a little bit of nausea post-surgery. It is completely normal and this settles down within 4 to 6 weeks. Usually none of my patients complain of these symptoms even 1 week after the surgery. The maximum period for this symptom to come down is usually about 4 to 6 weeks. Another common question is, what happens if gallbladder disease is left untreated? Gallbladder disease is a very distressing problem and the pain is very diffuse. Usually patients cannot point out what the problem is. It can arise as a pain in the back, it can arise as a pain in the right upper abdomen. Sometimes whenever you eat a heavy meal, the pain comes back, it is very intense and there's a lot of nausea and vomiting, and these are very distressing symptoms. Also, when we treat gallbladder for stones and we remove the gallbladder, it doesn't harm any bodily function. So you can go about doing all your routine activities with ease if you get your gallbladder disease managed early. Who is at high risk for developing gallbladder disease? The most common age group is a female who is premenopausal close to the age of 40. This is mainly because of hormonal changes. Also, certain conditions such as pregnancy can lead to gallbladder stones. If you're consuming a high cholesterol diet, that is the highest risk factor for developing gallbladder stones. Gallbladder disease itself is related to high cholesterol. If your cholesterol levels in your blood are also high, this can reduce the gallbladder emptying time, which will cause thickening in the bile. Thereby, crystals are formed which lead to bigger stones in the gallbladder. And stones can cause inflammation and infection in the gallbladder. Another common question is, can gallbladder diseases be prevented? For any disease in the body, there are modifiable and non-modifiable factors. Non-modifiable factors being your genetics, which will promote certain diseases in your body. Modifiable factors are related to your lifestyle. Gallbladder diseases are becoming increasingly common because of our lifestyle. If you change your diet, if you change your exercise patterns, if you keep your fatty diet intake low, if you keep your non-vegetarian intake low, you can always prevent gallbladder disease. So to help you understand gallbladder diseases better, please visit a licensed medical practitioner who can help you diagnose the problem better and also give you all the treatment options available. And if you have any further questions regarding gallbladder diseases or any other surgical problems, please do hit us up in the comment section below and we will be ready to answer all of them. If you like the video and if you think the information was helpful, please share this video with your friends and family who might need to know more about gallbladder diseases, and subscribe to the channel so we can keep you updated on more such stuff.